kiss for you.
My name is Keitumetse Komati. I'm a speech therapist and audiologist. A speech therapist is someone who deals with disorders that are related to language and speech difficulties, as well as swallowing and feeding difficulties. So you can have a child or an adult that would have maybe suffered from a stroke or might have other neurological disorders such as autism spectrum disorder. So basically anything that results in any kind of disorder with speech and language and swallowing. Okay, so in speech therapy we have speech-related disorders. So that would be articulation errors. So for instance, if a child can't say the R sound, so we would deal with such things. Then we have language disorders. So basically if a child has poor vocabulary or they can't follow instructions, they have issues with keeping up at school with English or even their home language sometimes, or they just have issues with expressing themselves. And then we have feeding and eating disorders. So normally these come from strokes. So after stroke, normally older people will have difficulty with swallowing, and that's what we call dysphagia. But even in little babies, so newborns that have issues with sucking the breast, we deal with that. Then we also deal with voice disorders. So if anyone has any issues with their vocal cords, if they can't speak properly or their voice is hoarse or rough due to trauma or maybe they have a nodule on their vocal cords, yes, we deal with it. So on the other side we have audiology. Audiologists deal with any hearing related problems. So if you have a hearing loss, or you have ringing in the ear, or you have an ear infection, and sometimes patients come with issues of balance that are caused in the ear, so that we call vestibular disorders. So that's what the audiologist would deal with. We also do hearing aid fittings. So if you have a hearing loss, then we would give you a hearing aid to assist you with the hearing loss. Okay, so this we do for both old patients and young patients. Speech therapy and audiology are related because if you cannot hear, then you're going to have a speech problem or a language problem. So if you can't hear people speaking to you as a child, then you're going to have issues with expressing yourself in the long run. Similarly with older patients, if you know the older that we get, the more we lose our senses. So if the older patients are having difficulty with their hearing, then it's going to affect how they communicate and how they express themselves with their communication partners. So the one can especially when it comes to audiology, it can affect the speech and the language of the patient. So that's how they are connected. Okay. So in audiology, we have several tests, and each test is responsible for a different part of the ear, because different parts of the ear have different functions. So we do tests for the outer ear, for the middle ear, and the inner ear. But the main test that we do, which we call the golden standard, is what we call the pure tone test. So this one basically tests the threshold of hearing of both your ears. So we plot the threshold on what we call an audiogram. So it looks like this. The circles indicate the right ear and the crosses indicate the left ear. So this person here, in the right ear, this person would have a normal hearing. So anything above 25 is normal, and anything below that is a hearing loss. So depending on the severity of the loss, we would fit you with a hearing aid that fits your type of hearing loss, and we would program it according to your needs. So how we choose the hearing aid will be depending on that, and there are different sizes, there are different colors that people can choose from. This one specifically goes behind the ear. Then we have ones that go right inside the ear, and those ones you can hide them a bit so people don't have to see that you're wearing a hearing aid. These also come in different colors. And we have other options for kids as well. So with kids, we don't want it to be loose, so we would have something that secures the hearing aid on the ear, just to make sure that when they're playing, it doesn't fall off. And we would have clips as well, just to make sure that it's secure and it doesn't get lost when the kids are playing at school. Okay, so this is a typical hearing aid. This one in particular is brown in color, so it fits very nicely with dark-skinned people. This portion would go behind the ear, and then this tube here would be connected to what we call domes that will go directly in the ear. So there's a mic somewhere here, and it receives the sound and then it transmits the sound directly inside the ear. So these ones go directly inside the ear. This is the smallest one, we call it a CIC, and we have the bigger one. So depending on your hearing loss and the severity of your hearing loss, it would depend which one of these you would qualify for. So no earbuds, no matches sticks in the ears, nothing should go inside the ear. Your ears are self-cleaning, so avoid putting anything inside the ear except your finger and a washcloth. That's the only thing that should go inside the ear. Otherwise, your ears are going to clean themselves.